Alrighty, here's the trauma assessment. First, we're going to put up gloves, and make sure we have gloves on. Don't want to contaminate anything. Then we're going to size up the scene, make sure there's nothing crazy that's going on that would hurt our personal safety. We'd also make sure that we didn't have any extra patients, so we didn't need to call extra EMS. We'd want to look and see what would hurt, what would have caused the mechanism of injury. And so what we're going to do for this one is a sprained wrist, specifically the left one, which is on your side right there. And we would also want to check and make sure that there's no spinal injury. Spraining a wrist is not going to likely cause spinal injury, so we'll be okay with that. We'll do a primary assessment. Sir, my name is Brent, and I am a student at NC State studying EMR. Is it okay if I check you out and try to help you in any way? Yes. Okay. Then we're going to check and see what his chief complaint is. Sir, first off, what's your chief complaint? What's wrong here? He sprained his left wrist. All right. So we're going to go over to his left arm. Sir, I'm going to need you to tell me if anything hurts right now, all right? And I'll just slowly palpate down until we hit the injury and go lighter. Does it hurt right there? All right. And we'll go all the way to his hand. Sir, can you wiggle your fingers? All righty, thank you. Do you feel this? Yes? All right. And make sure there's a pulse there. All righty, that's good and strong. All right. Then we're going to go ahead and make sure he's all together there. His breathing he was able to respond to me, so he obviously is able to breathe. And he doesn't really have to have anything crazy for that. We'll check a pulse on the non-injured arm. And it's good. All right. We'll make sure his skin color looks all right. This looks normal for a stick-built man, and he's all right there. Then we also need to check and make sure that there's no major bleeding, and if so, we need to control it, but with a sprained wrist, there shouldn't be, typically. And then if he's needed to, we need to put him in shock management. A sprained wrist shouldn't result in major shock, so we don't need to do that. Then we're going to do a secondary assessment. Sir, is it okay if I check and make sure that you're all okay? Sometimes when you hurt something and the worst felt pain is going to block out other injuries, do you mind if I check for that? All right, thank you. First, I'm going to check out your head right here. I'm going to palpate the palpate the head and the ears, scalp and ears. Then we're going to also check his eyes with an eye pen, make sure they're even, not blown, and dilate correctly. Check the bones of the eyes and the mouth. Sir, can you open and shut your mouth? Alrighty, bite down. Thank you. Check the chin. And then we go on to the neck, make sure his trachea is midline. We'll palpate the back of cerebral area in his spine. No pain. All right. And then we'll check both jugulars, make sure there's a pulse in each of them. Then we're going to move on to palpating the abdomen, making sure that there's no injuries here. We'll just slowly reach across right here. All right. Check the sides. All right. No kidney damage. All right, there we go. And then we're going to go on, and if there is any damage, we'd also want to check breathing here, underneath, and underneath each arm. So for here, and here on the patient. After that, we would go to the lower extremities and palpate all the way down. All right, no pain, all righty. And sir, can you wiggle your toe over here? Thank you. Do you feel that? All right. And there is a pulse. All righty. And then we're going to walk across. And we're going to check the other leg. Make sure to avoid the injury. Palpate down. Can you wiggle this toe, sir? Thank you. Can you feel that pinch? Yep. And there is a pulse. So now with this being the injury right here, we're going to take special care to check on this upper extremity. We're going to palpate all the way down. And since there should be a splint right here, we're going to just jump over that because we've already done that earlier. Sir, can you feel this pinch? Thank you. Can you wiggle your fingers? Thank you. And there is a pulse. So we'll then go to the other side of the patient and do the same thing, but all the way down this time because there's no injury. All the way down. Sir, do you feel that pinch? All right. Can you wiggle that finger for me? All right. And there is a pulse. Alrighty, after that, you would sit the patient up as long as there is no spinal injuries. So with this wrist injury, we would make sure to lift him from this side, give him a little pull, and he should sit up. And we're just going to use the pillow as a back. And we're going to slowly palpate the back and make sure there are no crazy injuries here. Go down to the lumbar and the butt. Alrighty, no pain, sir. Alrighty, you can lay back down. We'd also want to then check and see medical histories, if he's allergic to anything. Also collect vitals, which includes the blood pressure, the pulse, and his respiratory rate. We want to make sure that there's no minor injuries, and if so, we need to address them, like minor cuts or bruises. And then we'd also want to take him to the hospital since he did call us. Alrighty. Sir, we're going to take you to the hospital now. Thank you.